Excuse me, Dr. Amazing. I was wondering if you could help me.
Why sure, Billy. What do you need?
My teacher assigned me a book report about hypothermia, but I don't know what that is. Give me a little help.
I sure can, Billy. Why don't we start off with a definition?
Hypo means low, thermia, heat. Hypothermia, low heat. The body's normal core temperature is 37 degrees Celsius. If that body temperature should drop by 2 or more degrees, it's a safe bet that you're going to be hypothermic.
How does one become hypothermic?
That's a great question, Billy. Here's how.
Now it's time we learn about heat loss. There are 6 ways the body loses heat. Through radiation, respiration, evaporation, conduction, convection, or even excretion.
What does it look like?
There are 3 different stages to hypothermia.
The first stage of hypothermia is mild. In this stage, you'll notice there's going to be shivering and slurred speech. Pulse rate will probably remain normal, as will breathing. The mental state will be conscious, but the person will be withdrawn or disinterested. The next stage is moderate hypothermia. You'll notice that shivering will either become more violent or will have stopped altogether. You'll still have slurred speech, followed by clumsiness or stumbling. The pupils will be dilated. The skin will become bluish. Your pulse will become slow and weak. Your breathing will also be slow and weak. And your mental state will be confused, sleepy, and possibly irrational. The last stage of hypothermia is severe hypothermia. Shivering will have stopped completely. Your pulse is weak, irregular, or it may not even be present. Breathing is also slow or may be absent, and your mental state is unconscious.
Be aware, Billy, that hypothermia can be mistaken for drug abuse, drunkenness, or even a stroke. So if you see someone that looks perhaps like a drunk smurf, he very well might have hypothermia.
If they are hypothermic, what can we do?
When dealing with a hypothermic patient, you'll want to prevent further heat loss, cover exposed areas, secure the patient from the wind, remove the patient from the cold if you're able to, remove tight clothing. If there's shelter, remove the wet clothing in the shelter. Give the patient dry clothing or blankets. Insulate the patient. Handle the patient gently. Give warm, non-alcoholic, non-caffeinated drinks. And in a safe environment, give CPR until medical care arrives.
Hold it right there, Billy. There's one thing we do need to talk about. Frostbite.
Frostbite is freezing of the skin tissue when it's exposed to temperatures below 0 degrees. Superficial frostbite is freezing of the top layer of skin down to the full thickness of skin. Most susceptible areas are your ears, cheeks, nose, fingers, and toes. The skin may appear white and waxy. Pain will be followed by numbness. The skin will be firm on the surface, but it will be soft underneath. To treat superficial frostbite, you're going to want to cover the affected area. Warm the affected body part with body heat, either by breathing on the affected area or placing the affected part in a warm area of the body, like underarms, abdomen, or the groin. Deep frostbite, as you can imagine, is more severe than superficial. It can affect not only the skin, but the tissues beneath the skin, and can progress all the way to the bone. It can affect an entire hand or foot. The skin will be waxy and white, but that can turn gray or even blue as the frostbite progresses. The skin is cold and hard. There'll be no feeling in the affected area. some things to keep in mind when you're treating deep frostbite. Permanent damage is affected directly by how long the part is frozen, how much the part was used, and how the part has been thawed. To treat deep frostbite, you're going to want to make sure that your patient is warm and comfortable. You're going to remove the clothing from the affected area. You're going to want to place the frozen part in warm water, adding more warm water to maintain the temperature. This can be done by filling a container that is large enough to hold the frozen part with water, and then make sure the warm water itself is about 40 degrees Celsius. You're going to want to dry the affected area, place sterile dressings over the wounds and in between fingers and toes. You're going to elevate and keep the part warm. You're going to monitor the patient's condition and ensure that they get further medical treatment. A final note to those that are going to be treating patients for frostbite. Be gentle. Do not rub the area. Do not rub snow on the area. Do not break blisters that will form. And do not apply direct or extreme heat.
Thanks for the tip, Doc.
Not a problem, Billy. Anytime. Just make sure that door doesn't hit you on the way out.